Good morning everybody. Now today we are going to do the ECG practical. As I told you in the lecture, I think you can remember we have some nomenclature, right? So what is electrocardiography? The procedure of recording the ECG is known as electrocardiography. And the machine we use to record the electrocardiography is known as electrocardiograph. So I will show you, this is the electrocardiograph or the ECG machine. And when we obtain the ECG recording, we call it as electrocardiogram. So the recording is printed on this ECG paper. So when you get the print, we call it as electrocardiogram. Right. Now I'll show you the ECG machine or the electrocardiograph. Now can you see in this electrocardiograph or the ECG machine, we have some switches you have to identify. First we have this power button and we have lead selection switches. Alright, so you have to know, you have to be familiarize yourselves to operate this one clearly, how to transfer between each leads when you are doing the procedure. And this is the ECG gel. This is a specific one which is used only for these purposes to apply on the skin, and then it can reduce the resistance between these electrodes. Alright? Okay. Now we will start the procedure. Right. Today we are going to record the 12 lead ECG. The normal conventional ECG is usually 12 leads. So there are 6 limb leads and 6 chest leads. So 6 limb leads will be consisted of 2 things, that is unipolar and bipolar. So what are the bipolar limb leads? Lead 1, lead 2 and lead 3. And what are the unipolar limb leads? AVR, AVL and AVF. And then we have chest leads, 6 chest leads starting from V1 to V6. So I will show you our limb leads. These are the limb leads we are going to attach. Can you see there is a specific color code? Now this one, can you see this is red? Okay. So red is, we are going to attach it to our right hand. Red is for right hand and this yellow is for our left hand. Okay. And then green one is for our left leg and black one is for our right leg. I think you can remember that I told you right leg is not used as a lead, but it is just for the earth. So only we use right arm and left leg for the leading purposes. Alright? Okay. Now we will start and I will show you how to apply all these electrodes and do the recording. First, we will keep the patient supine, right, and ask the patient to be relaxed properly, and then we have to clean the surfaces where we are going to attach these electrodes or these leads properly using surgical spirit and a cotton wool. Alright? Right, now we are going to apply the gel. So just above his wrist area, near a bony prominence, we are going to attach the lead. This red one for the right arm. You have to apply the gel properly, otherwise the resistance problem will occur. And then we apply the lead like this. Then we apply the left arm, that is yellow color. And then left leg we apply the green colored one. See the green color. that is just above the ankle or the body prominence, and then black one to the right leg. Now the chest leads. Right, now I'll show you how to locate these ribs and the intercostal spaces. First, you are just palpating from the toe, and then when you are palpating down, you can feel a small notch. This is the notch. This is called the sternal notch. Okay? And then when you are coming down like this, you can palpate and feel there is a ridge-like thing. There is a small prominence. So this is called sternomanoprial joint. So just corresponding to that, you can feel the second rib. Alright. So just below the second rib, you have the second intercostal space. And then you have the third rib, third intercostal space, and fourth rib, fourth intercostal space. Right? So how to locate and how to apply the V1 and V2, you know, just immediately to the right of the sternum at the right intercostal space, you apply V1. And then just corresponding to that V1 position to the left, we apply the V2. So these areas also you have to disinfect using surgical spirit, and then V1 here and V2 here. In these leads also they have mentioned V1, V2, V3, V4, V5, V6 like that. So you can find the leads easier. Okay. Now then, without attaching V3, we locate where to keep or attach V4. So V4 is fifth intercostal space, mid-clavicular line. So like we did how to locate this fourth intercostal space, then you have the fifth rib and the fifth intercostal space. And then you know the mid-clavicular line, you can take the two ends of the clavicle like this, and then roughly the midpoint between the two ends of the clavicle, that is mid-clavicular line, you just take an imaginary line, that is the mid-clavicular line. So that is V4. Okay. So between V2 and V4, we just apply the V3. So how to locate the next one, V5 and V6? Again, along the fifth intercostal space, we are coming to the anterior axillary line. That is downwards along this fifth intercostal space. We have the V5 and then mid-axillary line roughly at the mid-axillary area. That is V6. Right, now we have done all the lead attachment. Okay, so all the limb leads are being attached and chest leads, 6 chest leads are being attached. Now you should remember one thing. Now when we select from one lead to the other lead within the machine, now suppose if we select lead 1, it will connect internally the right arm and the left arm. Like that, internally the machine will create an internal circuit within the machine to give the proper tracing belonging to each lead. Lead 1, lead 2, lead 3 and the other leads as well. Alright. Now after attaching everything, we are going to start the machine and get the recording. Right, now this is the whole ECG or the electrocardiogram. Can you see? You can see lead 1, lead 2, lead 3, AVR, AVL, AVF and V1 to V6. So all the 12 leads are being recorded in this ECG. And can you remember that I told you, you have to get a rhythm strip to check whether this patient is having a regular rhythm or an irregular rhythm, and also to do the proper rate calculation, heart rate calculation, you have to take the rhythm strip. For that, we take this lead 2 for a longer duration. That is called the rhythm strip. Now we will show you how to get the rhythm strip. Right, now after taking the whole ECG, to calculate the rate and to look at the rhythm, whether it is regular or irregular rhythm, we are taking this lead 2 for a longer duration, which is called the rhythm strip. That is actually the longer duration measurement of lead 2, whole rhythm strip. Now we will show you how to get the rhythm strip. We select the lead 2 only manually and then press OK. Then we will get the rhythm strip. So you can see lead 2 is being recorded for a longer duration. Right. After that, we can pair it. Now this is the whole ECG, 12-lead ECG with the rhythm strip. Now the very important thing you have to do, after taking this one out, you have to write the patient's name, age and the time and the date taken on the top of this ECG at the very beginning. Right? It is a very important thing you have to remember. Alright. Now I think you have learned how to record the 12-lead ECG properly, how to attach the limb leads, chest leads, everything. And then we will move on to the other steps, that how to calculate the heart rate and how to detect arrhythmias or other ECG abnormalities using our ECG tracer.